is an interesting case. I have got a patient who has been diagnosed as a chronic filariasis patient. She has got chronic lymphedema in her lower limb since last 10 years, and recently she felt something causing her pain in the lower aspect of her right limb, and also there were some complaint of difficulty in walking, and she did not have any trauma, and there was swelling in her lower limb because is a filarial patient, but she noticed that some amount of pain which was not correlating with her current condition. So for that, MRI scan was done. So this is the axial PDFS sequences. The extensive amount of subcutaneous thickening and the amount of fluid that we are seeing, this is typical of the chronic lymphedema. So the patient has been having this lymphatic obstruction since long time, and because of the chronic lymphatic obstruction, one of the typical characteristic that happens is proliferation of the subcutaneous fat. So if you see, the amount of fat here is disproportional to the routine length which we should be able to see, and small some amount of fluid locules or reticular appearance of the subcutaneous tissue is also maintained. Now coming on to the bones, so when we see the coronal PDFS sequences, there is significant amount of edema in the distal tibia. This is more so along the lateral aspect, and in the distal fibula as well there is significant edema, and there is irregularity of the cortex. There is a clear cortical break evident on both the aspect of the distal fibula, and we are able to see some amount of soft tissue surrounding it. So this would be a fracture which has got a small amount of callus forming around it. Now looking forward towards the images in T1 weighted sequences, we are clearly able to see a unicortical break which is extending up to the cortex and with surrounding significant edema. So this type of injury without any complaints of any trauma, if the patient experiences such things, we can think of it as an insufficiency fracture. So the fracture in the distal fibula, it is a bit subacute because we have got a callus formation here as well. On the other hand, in the tibia, the fracture is involving only one cortex. It is not through and through like the fracture that we see on the fibular aspect. So both of these type of fractures are a type of insufficiency fractures. Whenever you see a horizontally oriented fracture line with disproportionate edema, which is sometimes obscures the fracture line, here we are able to see some hypointense fracture line developing, but sometimes in early stages, if the patient comes, there would be significant amount of edema which would be obscuring the fracture line. So it is advisable to always look at the T1 weighted images, wherein we will easily be able to see the fracture lines. And in types of insufficiency fracture, usually this fracture line is parallel to the articular surface. Like in this region, we see an oblique or parallel line to the tibial articular surface. Thank you.